Morning. I survived the HSG test. It was not as bad as everybody said. I'm not going to lie. When they put the catheter in, that made me cramp, but it wasn't the worst period cramps I'd ever felt in my life. They put the catheter in, they blow up the balloon, you cramp some, but like I said, if you've had bad cramps, you're going to live. It's not bad. And then when they started injecting the dye, I didn't feel any pain. I was told that if my tubes were blocked, it could feel like labor pain. Now, this was by somebody who had had the test, not the doctor. I didn't feel anything. I mean, I felt something, but it wasn't like I was going to die. Like, the cramps stopped. I was okay. So they pushed the dye in. My doctor let me watch. Everything was normal for me. Nothing was blocked. But did you know that your fallopian tubes, and I may be dumb on this, but you know the diagrams they show of like the fallopian tubes being like straight and like connected to the ovaries? One of my fallopian tubes looked like a curly fry and the other one was like squiggly. And I looked at her and I said, "Is that normal?" And she said, "Yeah." And I said, "You mean the diagrams lie?" And she goes, "This," and she sticks her arms out and I just start laughing. She's like, "No, nobody's fallopian tubes are straight like that." So if you didn't know, now you know. It actually, I was looking at it and I'm like, I don't know what I'm looking at. And it was like kind of like a cup V, and then it looked like two veins coming off. That's all it looked like. I was expecting like this big like V full of dark dye and then these giant tubes going off to the sides. No. I mean, I didn't know what I was looking at. So anyway, everything for me is normal. If there was anything, it flushed it fast. They couldn't tell, but everything went through the way it should. My test had clear dye. I don't know if that's all test. I did bleed a little after, and I think that's because this was like the end of my period where I was still kind of spotty. And you know, sometimes if you like do anything or, you know, you can spot some more. Well, I spotted some. So I had to wear a pad on the way out because of course you're leaking the dye. And then today I have to wear a panty liner because I'm still spotting a little bit. Nothing big, but like I have to wear something. So, sorry for the shakiness. I'm in the car and I'm holding this phone once again. I'm at work. But it was not bad. It was not like everybody said. Like, I was completely terrified. After the test, I'm still laying on the table because I haven't sat up yet. And my doctor leans over and looks at me because I've been trying to avoid this. Yes, it's expensive, but part of it was I was completely terrified. And I looked at her and I just started laughing and I said, "This is what I've been avoiding." So the 29th, I have my ultrasound for ovulation, and then we will talk about what we're going to do next, probably IUI, just because I'm not blocked up. If it was completely blocked or something like that, of course we'd go to IVF, but I'm not blocked. Anyway, I just thought I'd update you guys and let you know the HSG is not as bad as everybody says. I'm not saying that everybody's going to be the same, but let me tell you, I sat in that little waiting room where I could hear other patients having it done. I heard 2 other women go through it. Except for the one woman who the positioning of the catheter was having an issue, neither one of them acted like it hurt that bad. So that's 3 of us. But anyway, if you're having it, don't be scared. I'm telling you, it's not as bad as everybody makes it. And don't be a dummy like I was and YouTube it. I mean, obviously you're YouTubing it if you're watching this video, but stop here. All right. Well, I will keep you guys updated on what our next thing is. And you guys have a good rest of your day. Bye.